You know, May is Women's Healthcare Month, and each year, millions of women enter into menopause. And there are a lot of common menopausal myths that our next guest is going to help us debunk today. She's the author of Unlock Your Menopause Type. Please welcome Dr. Heather Hirsch. Hi, Dr. Hirsch. Thank you for being here. Who knew that there was a menopause type?
Yeah, well, after treating women for over a decade, I really began to see a lot of different phenotypes come to light, and that really helped me individualize their treatment plans.
Okay, let's go over some of the myths.
So, one of the biggest myths is that you have to have menopause at age 50. And actually, there's a small subset of the population, anywhere from 1 to 5% of the population, that has menopause before age 40. My youngest patient is 17.
Oh, you're kidding.
Wow.
Yeah, and what's really important to know about young menopause, which is really defined prematures before age 40 and early is before age 45, is that hormone replacement therapy is absolutely the gold standard of care for these women because of their long-term health consequences if they don't use it.
Okay, what's next? Because I cannot believe that somebody who is 17 can go through menopause.
You know, these women have, well, one of the reasons is it can be autoimmune, it can be genetic, and in some cases it can also be surgical. And these women often feel out of step with their peers, right? You're in high school, or if you're in your late 30s, your friends might be breastfeeding or trying to get pregnant again. And so it's really important that they seek support from women who are also undergoing early menopause, premature menopause. They need peers who understand exactly what they're going through.
Okay. What's another myth?
So another myth is that hormone replacement therapy is risky.
Yeah, we always heard that, right? I mean, we always heard that.
It's not only, we were like warned by people in our family, like, don't do hormone replacement.
This is really common, and this myth stems from this old study that came out over 20 years ago called the Women's Health Initiative, or the WHI. Now, what we know now, we use different formulations of estrogen and progesterone than they used in that older study. So some of the big risks that really scared people, cancer and blood clots, are extremely mitigated if we use different formulations. And while you should always talk to your doctor about what is best for you, I like to start my patients with a transdermal, FDA-approved bioidentical estrogen.
Yes, we know the word bioidentical.
And then a bioidentical oral progesterone called Prometrium. And this formulation is really safe. In fact, I will take this a step further. The Menopause Society really recommends for women who have symptoms and who start within 10 years from menopause that the benefits vastly outweigh the risks.
10 years, what did you say?
There's a menopause. There's a menopause society.
There is a menopause
It's
society.
like a menopause secret society.
Is there a menopause husband support group?
You should start one, Mark. This will be a great one for you. Yes, the Menopause Society is NAMS, which stands for the North American Menopause Society, and really made up of experts and clinicians and healthcare providers who care a lot about women going through the midlife transition. And there's only about several hundred when you think about the fact that there's 30 to 50 million women who need help. That's one of the reasons it's so hard to get help.
What if you cannot, for whatever reason, take any form of hormone replacement? Are you just doomed to a life of going through menopause forever?
You are not doomed. And there is a type I call the sudden menopause type, often from surgery or chemotherapy from gynecologic cancers. Women who take medications that stop their periods, one's called Lupron, chemotherapy, radiation, these can stop your periods in your tracks. And you're not at all doomed. There's lots of things that women can do if they can't take estrogen, such as really place some emphasis in their diet, eat an anti-inflammatory diet. There's some great supplements to help support you. Vitamin D and calcium are so important for bones. B12 is good for energy. And zinc, iron, magnesium, these are great supplements to add to your regimen. There is even a medication that's non-hormonal that helps with libido, which is something that women also care deeply about, especially if they're affected with menopause so suddenly or so early.
Okay, this is all great advice. We're going to come back to after the commercial break. More with menopause myths and debunking them with Dr. Heather Hirsch. Stick around. We're back with Dr. Heather Hirsch, debunking some of these most common menopause myths, like menopause affects your body, not your mind.
Oh my goodness, menopause absolutely affects your mind. We have hormone receptors in our brain, so it makes sense that for many women, their moods can really change. And in fact, on a serious note, rates of suicide among Caucasian women are highest in the 45 to 55 age bracket, which coincides directly with menopause. And not only mood, but cognition. So brain fog, trouble with memory, recall, word finding.
Finding my words.
Those are really big symptoms. And women really worry that they're having early dementia or Alzheimer's disease. They come to my office extremely concerned about their mental health.
So exercise is important for this part as well?
This is where I say exercise is truly medicine. So exercise and movement are so important if you have the mood type of menopause. And swimming has been found to really decrease risk of depression.
Swimming?
Yes.
Swimming specifically?
Swimming specifically.
Why? Any reason behind that?
Something about being in that 3D water and kind of floating through. I'm not a big swimmer myself, but it really has been shown specifically to decrease depression risk.
Is there a time limit on the symptoms of menopause that is supposed to last only a year? What's the myth?
That's a huge myth that menopause lasts this 1 year and then your body's back to normal. And in fact, 75% of women have symptoms that last on average 5 to 7 years. Wow. And I call this the lingering menopause type. And these women are always busy taking care of their kids and their spouses and their houses and their pets that, you know, they look down and all of a sudden 5 years has gone by where they're still suffering with lingering symptoms like hot flashes or low libido or brain fog.
So give me some of the treatments for, let's say, if you knew someone at work that was suffering from hot flashes. What are some things that people can do to relieve the hot flashes?
Well, estrogen hormone replacement therapy, which we talked about, is the FDA-approved best and most effective method to alleviate hot flashes. It really isn't so safe, but there are many other things that women can also do. Diets rich in phytoestrogens, soy isoflavones, things like hummus and edamame are really good options too. Making sure you're staying mindful. You can do things like self-hypnosis. Actually, there's apps for that now. And these can actually all really help you calm your sympathetic nervous system down so that you can relieve those hot flashes on the spot.
You can hypnotize the menopause away. That's amazing.
I'm getting that app.
What about if you don't have hot flashes anymore? Does that mean you're done? Does that mean menopause ended?
That's another huge myth. And I call this the silent menopause type. There's always the one friend in the friend group that walks away without any symptoms at all. But the thing is that your body really changes after you don't make estrogen anymore. And so things like your bones change, and they're really important. Your brain, your heart health. Now, heart disease is the #1 cause of death in women, and more women will suffer an osteoporotic fracture than heart attacks, breast cancers, and strokes combined. So these are really important. And you may sort of forget your routine screening test because on the outside you feel so good,
right? But
your body is still different on the inside.
So you have to make sure you still have all of your regular checkups, bone density screenings, heart health checkups, that sort of thing.
Yes.
This is so important to know. Thank you so much. I really appreciate that. Don't forget to pick up Dr. Hirsch's book, Unlock Your Menopause Type. For more information, go on our website, and we'll be right back.